Okay, got a bit of a curly one to start with. We were asked, is Pharmac in the room today? If not, why? And how can we engage them better? As far as I'm aware, they're not in the room today. There we go. That's a good start. Perhaps I'll throw this at you, Rick. How was your engagement with Pharmac when you did Auckland's assessment?
There wasn't any, is the short answer, but I'm more than happy to sit down and talk you through what we've done both in the UK and with ADHB. Like everyone's mentioned, if we don't measure it, we don't know how bad the problem is. We can't actually start to pick it apart. One of the key bits of work that I had the privilege to work in the NHS was we actually got all the different respiratory leads across the NHS in a room over a period of months, patient groups, everyone that's relevant to asthma and inhalers, and through a workshop and supported by some of my modelling, we could actually work out we could reduce the carbon footprint of inhalers by about 50%. Over about a 5-year program and reduce the cost by 15%. So like it's a huge win-win. It just needs a bit of engagement, bit of time, bit of a hooey, and we can always come up with solutions.
Excellent. Next one is for Paul. Does ECA have a plan for all the lithium batteries that will be brought into New Zealand in EVs when they are at the end of their life? How will we manage this? Thanks. I'm sure that's not really one that you can answer, but perhaps you have some ideas on it.
Sure. So I said in my presentation we're the little P, not the big P, so Ministry of Transport are the big P. But I listened to one of the earlier presentations online where they talked about reusing and one of our forums, we had some EV guys talk, and I'll use a Nissan Leaf as a good example. You buy it, does 120 Ks. A few years later, it only does 80 Ks. You need to do 120 Ks in a day, so sell it, give it to someone else that can use it, that only needs to do 30 Ks a day. The point that it's no longer a car, take the battery out and put it on the wall in your garage. So keep reusing the battery until you actually need to recycle it. But it isn't ECA's wheelhouse in terms of doing that research. Do you want me to answer the other two while I'm going? So there was a question around a third of car trips less than 2 Ks. Is there a way to fund e-bikes instead of e-cars? Not out of the decarbonisation fund. The decarbonisation fund's trying to decarbonise the existing assets. We've done a great project with University of Otago where they've partnered up with someone to do on-site bike repairs, storage and charging. And we've co-funded that through our low emissions transport fund. Like a lot of things, you probably don't want to be running those facilities, find that outside partner to do it. The other question I saw in there was what percentage of heavy transport was in the 48% of transport emissions, and specifically meat and dairy. So about a third of transport emissions are heavy transport. I can't give a breakdown on how much of that's meat and dairy other than to say I know Fonterra, when they do their transport emissions, look at about 100 million kilometres, both in milk tankers and site to port.
Excellent. Margriet, this one's for you. Was food included in the analysis of carbon emissions of DHBs? Where does it sit compared to other areas? If not analysed, how can we start measuring?
With this overview that we didn't include food because we just took all the categories which were sort of measured along all over all DHBs, but it has been measured. In the past years ago, we didn't have emission factors for food, so we couldn't include it, but those are available now. And for Northland DHB, I calculated it, and food, so patient food would sit around place number 4 or 5 in a footprint. So after gas, fleet fuels and electricity, I think it was number 5. And I know Bay of Plenty did the same calculations, and I think you came to about the same percentage. So it's a fairly significant one, and it is something that we can start including in the future.
Yeah, so the carbon footprint of food does come through in the work we did with Auckland DHB. But again, sorry to be so NHS focused, but one of the pieces of work we also did in NHS was a water footprint for the entirety of the NHS. So it looked at all indirect and direct water usage, and food production was 50% of the entire water footprint. So in terms of, we've talked a lot about measurement again, but sometimes we need to broaden the metric, not just carbon. It's a really important, easy one. But when we start using different metrics and different lenses, actually different solutions to different problems come to the fore.
Next one's for Debbie. What is the place of Te Ao Māori in the design of sustainable health infrastructure? Have tangata whenua been engaged in this process?
Kia ora, thank you for that question. In our design guidance, we're saying right from the get-go to get a sustainability consultant on board right at the start, and a Māori cultural consultant right from the start, because every region is different, and we didn't want to set some kind of steps in stone when they might not really be relevant with the context that the hospital is going to be built in. So having the Te Aranga design principles as a platform and a guide, and then for the wherever the hospital is being built, actually in a location, and then actually engaging with the local iwi and the mana whenua of that area to make sure that that is actually built in and integrated right from the start.
Do you want to take the next one, Vicktoria? Why are DHBs not using their power and influence to lobby councils to put in active travel infrastructure to support their staff to cycle or walk to work?
Yeah, so that's a really valid question. So most of our public health organisations actually do provide responses to LTPs and annual plans and regional land transport plans and things like that. Personally, I sit in the Smart Growth, which is the name of our collective that we talk about things in Tauranga. It's a terrible name. And so I'm definitely advocating for public health and systems change while sitting in those spaces. So we do, but we have to do it professionally and not politicise it too much, if that makes any sense. But just know that the voice is definitely there. We're coming from a very strong public health perspective and the need to engage in active transport, but not just that, from the safety perspective, healthy streets, innovating streets, etc.
Thanks, Vicktoria. I'd like to throw one to Ben if he's still there. You said projects require a performance-focused approach, therefore reducing operational emissions. Where do embodied emissions come into this framework?
Well, I guess embodied emissions is less about performance, but embodied, Debbie made the comment about life cycle analysis, whole of life carbon analysis. Before you even start doing the analysis, you need to know how you're going to decarbonise your embodied carbon. A lot of that's driven by structures, but the more guidance from Ministry of Health, the better. Right at the start of a project, actually thinking about embodied carbon. Embodied carbon is less about, but it is in a way. You said it right at the start of a project. This is what we're going to do. Life cycle carbon. Things change through the design process. You've got to be thinking about the end game when it's constructed, not value engineering out decisions, changing things as you go. It's really the key is identifying those targets and actually following them through, and then performance is about measuring them, comparing back to what you actually set out to do right at the start. Yeah.
Thank you. The next one, maybe Margriet can give a go to. What's the best way for smaller organisations like GPs to measure their emissions profile? Can DHB sustainability officers assist?
To start with the last question, yes, we can assist, and I would probably be a good person to contact to help you out. But there is also a lot of online resources. If you go to the MFE website, go to voluntary reporting, there's a whole guideline. There is Excel calculators that you can use where you can just input your electricity consumption of your practice, likely the commutes, some other waste metrics. So there is quite a few resources that can help you. But just email me and I can get you started.
Just to add to that as well, I think it's MB and the Sustainable Business Network of New Zealand have created something called the Climate Action Toolbox, and it's designed for small, low number of employees, organisations to really start this journey. So it's a really useful tool.
Perhaps the next one DHB sustainability managers can speak to. Is there a plan for DHBs to look at food served in hospitals, measure emissions created by unsustainable food, and deliberately increase plant-based intake? I'll answer part of this. We're currently assessing our food at our hospital. We've got a project running where we're looking at things like tray waste and how that's managed, and assessing the carbon of that, with a view to looking at more sustainable procurement, but also more sustainable disposal of the food waste.
Yeah, I can probably add what we are doing at our DHB. So when our food contract came up for renewal, we put in the tender and the contract that we wanted to increase the amount of local food in our hospitals. So we've got a KPI in our contract that our contractor has to improve or increase the amount of local food from 15% to 50% over the next couple of years, and report on that quarterly to see how they're doing. Plant-based intake for patient meals is still an discussion point.
Yeah, the SMOs and RMOs are often the most difficult to pull along on that journey. So it's up to all of us to have those discussions internally with our colleagues.
I just wanted to mention that we have been running Meat Free Mondays in our in Tauranga Hospital for the cafeteria, which is staff and visitors, and that goes really well. But there's still a big discussion with dietitians around plant-based diet for patients, particularly elderly patients. So there is a lot more discussion. So if you're working in that space, if that is your space, bring those discussions to us, because
Margriet, do you want to take that next one? In Sweden, they scavenge N2O from maternity, Unistan destroy it to N2 and O2. Is there any discussion at the MOH about this technology?
I'm not really sort of knowledgeable in this space. What I do know at the moment is that nitrous oxide is really cheap, which is one of the barriers. If you want to move away to a different technology which becomes available, it is a cost discussion. But I think I think this is especially one area, because every DHB has this, which we could tackle nationally and have an innovation program and look at together to see how we remove that emission source.
I'll throw into Rick. How can we measure the emissions of things we procure?
There's a few different methodologies. So one is to go to your supply chain and ask for their information on their own carbon footprints and start breaking down the kind of proportion of your spend from that organization, which is timely, takes a lot of effort, and quite often I'd say 85% of the time they don't have the information, but I think it's still really good to ask, because it prompts them to think if one person's asking it, there's probably 50 people who want it. So please do that. Might not be the most productive route in the short term. The other option is to spend heaps of time and effort and break down in each individual product into its materials, and you can use different life cycle assessment databases to do that. That will also take you about 50 million years. So the approach we typically take, I'm not even joking, the approach we typically take is using a spend-based method. So we'll take your amount of spend on a different category or a different subset of that category in terms of your procurement spend. So it might say blood services, it might say catheters, whatever it might be. And you can apply that to carbon intensity factors for that dollar spend. It's nowhere near as robust as taking kilowatt hour data from electricity meters and applying it to the national grid factor, but what it does is help see the order of magnitude really quickly. Like that exercise can take kind of 8-12 weeks, not 50 million years. So it's a really good start, and it's a quick way of getting to order of magnitude to help you start trying to tackle the biggest problems.
You're going to take the next.
And sort of answering the question there, it wasn't included because we just didn't know how to do it. So it's good we've got Rick in the country and we've taken his passport away.
I think that's all we've got time for that session. Just like to thank all our speakers and panelists.